Well, good morning. Thank you very much for having me here today. My personal story is that in addition to helping to lead the American Hospital Association, I'm the son of a couple who helped in the 70s and 80s to establish a community-based hospice program, Hospice of the South Shore, back on my home area of Long Island. So it's been a long and very important connection to this part of the healthcare continuum. I thought I'd briefly share with you in answer to Phil's challenge of how are we going to support this, talk a little bit about what AHA has done, what we're doing, how we think that this time is right in the way the healthcare culture is changing, and then give a shout out for an organization that I think we all need to get behind. So first of all, for the last 15 years, Don and his organization, and the last 5 years, Peggy McGuire and the Cambia Health Foundation have helped us sponsor the Circle of Life Award, where we solicit, we visit, and then we recognize hospital-based, not necessarily just hospital-based, but hospital-nominated hospice and palliative care programs around the country. And then we do our best to feature them in all of our journals and webcasts and so on to try to promote best practices across the 5,000 hospitals in the country. We also support an effort that we call Put It in Writing. This has been a long-standing effort to try to help the hospitals help people, or frankly help the public directly with advanced directives, and of course we highlight that around the National Healthcare Decision Day, which we've helped to promote throughout the years. And a gentleman was kind enough to tell me in this room 2 weeks ago how much that has meant to that effort. We also, in the public policy realm, have called this out to better manage advanced illnesses. One of the things that has to be taken on in the policy realm, and as part of our Ensuring a Healthier Tomorrow framework for the continuing reform effort, we talk about better management of advanced illness, and we list specific activities, starting with ourselves, what hospitals and clinicians need to do, but also actions by government, by insurers and employers, and by individuals, because it's going to take all of us. But we continue to promote this in the public policy realm, as our senators were encouraging us to do this morning. We also publish guides for our members. We take those best practices and put them into guides. We spent a year on this subject with one of our board-level committees back in 2012 and issued Advanced Illness Management Strategies, one publication that's available to all our members free for downloading. And then we published a companion piece on engaging the community and a ready, willing, and able workforce around end-of-life practices. So we try to make those things very easy to access. Like I said, I always tell my members they're not free, but they were paid for by their dues, so they're prepaid. So they ought to take advantage of it. Currently, the past 3 years, we've been involved with the Hospital Engagement Network, trying to drive improvement in 10 clinical areas as well as readmissions. We've had great success in that, and I would politely push back gently on the Senator's comment this morning about bad things being profit centers for hospitals. Hospitals have partnered with March of Dimes and others, for example, to drive down early elective deliveries, which has done a huge amount to improve care for kids, but also, frankly, has taken a big chunk of activity out of NICUs, and it's the right thing to do, and it has saved a lot of money. We see the same opportunities in other areas where services don't provide benefit to patients, so we've got a new effort underway in appropriateness, 5 areas, one of which is around the appropriate use of the intensive care unit for imminently terminal illness. In other words, stop doing what doesn't help. We've already put out toolkits in blood management and antibiotic stewardship, stents, ambulatory conditions that don't need to be admitted. We're working now on the advanced illness toolkit. Again, all available to all hospitals across the country for downloading and use. So I think that the good news is that the time is right. Now you're hearing talk across the hospital field of patient-centered care, coordinated care, patient and family engagement, appropriateness, as I said, community engagement, all of which with the change in financial incentives means that I think that the time is absolutely right for this type of integration of the palliative and end-of-life care, along with other things that frankly have been on the margins, like behavioral health, for example. You're going to see a lot more of a comprehensive approach, and I think the change in financial incentives will lead to the change in the delivery system, all of which makes sense. But I would end by saying, and I don't mean this to be a downer, but I think we have to take a holistic approach or view across our society, not just our health system. And to get people, our friends and neighbors and relatives, to think this way is going to be nothing less than an entire change in national culture. It's going to require planning. Oh my God. It's going to require action. It's going to require less of a consumption orientation and more of a prevention orientation. So this is part of a much bigger picture. We have a big challenge. Therefore, my last point is I want to give a shout out to CTAC, the Coalition to Transform Advanced Care, because it is a multi-stakeholder coalition, something we've been very pleased to be part of from the early days, and ask everybody to get behind one coalition to push this effort forward with all the voices that we have. Thanks very much.